My approach to patient care is very patient-centric. So I was trained in an era where the patient-centered model of care was emphasized. And what that means for me is when a patient comes to see me, we're not talking about what their imaging shows or what a diagnostic test shows. We're talking about what it is they are there, what problem they are there to fix. So my patient visits always start with that question at the center, and all of the treatment decisions that we make are guided by what are the symptoms that patients are coming to see me for, and how is it that we can solve that in the most effective and safe way. After residency, I actually did a second fellowship training focused on minimally invasive spine surgery, and that's really my area of expertise. I also did additional training and visited surgeons in Asia to learn a specific type of spine surgery called endoscopic spine surgery, which is growing in popularity in the US. And that technique allows us to preserve motion in the spine, whereas previously without the access to that technique, patients might be looking at having fusion procedures, which, while they can be beneficial, come with their downsides. And so, I think my skills and expertise are unique in the community, in that my practice is really focused on motion preservation within spine surgery. I would like patients to know me for having what they might think is an old school approach as a physician, as someone that they're going to get to know and form a relationship with. Someone who calls them, in the evenings or weekends if they're having an issue. That's really something that gives me, great enjoyment. I think is good for patient care in general, to be available and accessible to patients. What I love the most about my job as a physician is the dramatic change I can make in people's situation. Most patients who come to see a spine surgeon are debilitated by their pain. They can't walk, or they can't work. They can't function, they can't do the things they want to do. And spine surgery is unique in that, with a relatively straightforward hour-long procedure, that problem can be solved for them, and they can move on from a problem that's really been debilitating for them for a long time.